Tirzepatide has been called a diabetes drug, a weight loss shot, a GLP-1 medication, and even treatment for sleep apnea. So, what exactly is it? And how can one medication apparently do all of these things? And in this video, I'm going to explain Tirzepatide in plain English, including how it works, the side effects that you need to know about, and the important differences between Mounjaro, Zepbound, and compounded Tirzepatide. My name is Mike. Welcome to the channel. Got to do a disclaimer here that I am not a doctor. Before you make any health decisions, please check with your own doctor first. In my last video, I explained why my doctor and I decided this might be an option for me. Today, I want to step back a little bit and explain what I'm actually putting into my body. So what exactly is Tirzepatide? Tirzepatide is the name of the active medication. Mounjaro and Zepbound are brand names that contain Tirzepatide. You can loosely compare that to like ibuprofen being sold under names like Advil or Motrin, with one important difference. So there's currently no FDA approved generic Tirzepatide, and compounded Tirzepatide is not considered a generic version of Mounjaro or Zepbound. I hope that makes sense. This is the same way pretty much that Tirzepatide and Mounjaro or Zepbound naming works. So Tirzepatide is typically a once per week injectable medication that activates two receptors that are normally stimulated by hormones released after eating, GLP-1 and GIP. Most people call Tirzepatide a GLP-1 drug, but technically it's a dual GIP-GLP-1 medication. Think of it as one medication that sends two different "we've already eaten" signals through your body. It's not an insulin or a stimulant, and it doesn't directly melt fat. It changes your appetite, your digestion, and the way the body manages blood sugar. So how does it work? Well, I would divide this into three simple areas. First being your brain. Tirzepatide works on appetite regulating areas of the brain. People commonly feel less hungry, become full sooner, and have less interest in continuing to eat. It doesn't physically prevent you from eating. It turns down the volume on the hunger signals that we get. They're constantly telling us that we need to eat something. And the second thing is your stomach. It slows how quickly food leaves the stomach area. Food stays in your stomach longer, so the meal you just ate continues making you feel full longer. And third is your blood sugar. When your blood sugar rises, Tirzepatide helps your pancreas release insulin. It also reduces glucagon, which is a hormone that tells your liver to release stored sugar into your bloodstream. In simple terms, it helps prevent your blood sugar from climbing too high after you eat, which explains why Tirzepatide was originally developed for type 2 diabetes, but also produces substantial weight loss. So what all is Tirzepatide approved to treat? Well, Mounjaro is the diabetes brand. It's FDA approved along with diet and exercise to improve your blood sugar control in adults and children age 10 and older with type 2 diabetes. Zepbound is the weight management and sleep apnea brand. It is FDA approved for long-term weight reduction in adults with obesity or adults that are overweight and have at least one other weight-related medical condition. And then it's also been FDA approved for moderate to severe sleep apnea. So how does this work with sleep apnea, which is the reason that I've been led this? Tirzepatide does not mechanically hold your airway open the way that a CPAP machine does. The sleep apnea improvement comes mainly from reducing your body weight. Reducing weight decreases the tendency of the airway to collapse when you're sleeping. In two 52-week trials, the Tirzepatide groups experienced average reductions of approximately 51 to 59% in their apnea index, which is the number of times breathing stops or becomes shallow every hour. The FDA says the improvement was likely related to the accompanying weight reduction. Now, and this is important, this does not mean someone taking Tirzepatide should simply stop using the CPAP machine. The studies did not determine when it is appropriate for someone already using CPAP to discontinue it. That decision needs to come after follow-up tests and conversations with your doctor. Mounjaro and Zepbound are not two completely different medications. They contain the same active medication, but they are marketed and FDA approved for different medical purposes. It just gets confusing. Because they contain the same active medication, Mounjaro and Zepbound work in the body the same basic way. The difference is the medical condition each brand is FDA approved and prescribed to treat. Then we have the non-branded options, which are commonly known as compounded products. An FDA-approved medication is manufactured in a standardized facility. It's tested and reviewed, and then distributed in a finished dose. Compounding is where a pharmacy prepares the medication for a particular patient, sometimes using a different strength, concentration, or ingredient combination that's prescribed by your doctor. A compounded product is not an FDA-approved generic version of Mounjaro or Zepbound. The FDA does not pre-review compounded drugs for safety, effectiveness, or quality in the same way it reviews approved medications. That's why they give it the approval. Compounding can serve as a legitimate medical need when a patient cannot be appropriately treated with an available FDA-approved product. Compounding does not automatically mean fake, and it does not automatically mean unsafe. But it also does not mean FDA approved, generic, or identical to Zepbound. Who makes it, how it's made, the concentration, and how the dose is measured, that all matters. The compounding of Terzepatide became popular when demand outpaced production, and Terzepatide was placed on the FDA shortage list. During a shortage, compounding pharmacies and outsourcing facilities have broader ability to produce versions of an unavailable drug, basically. Now, the FDA has reported concerns about compounding, mainly incorrect dosing or increasing doses too quickly, products containing concentrations different from what the patient may have expected. There's some misleading claims that compounded products are the same as the approved brand. And then there's fraudulent labels, contamination issues. This is why it's so important to make sure the compounding pharmacy you might use has a good reputation. Your doctor most likely deals with one that he trusts already. I do have to say, since researching this topic, every social media platform I'm on, I get bombarded with ads for GLP-1 compounds. There seems to be hundreds of them out there. The main reason compounds are popular is pricing, for sure. I've seen ads as low as $99 per month on some of them. That's a far cry from the thousands that were being charged for brand names when there was a shortage. However, many of these very low-cost options have issues. That low advertised price may not be it may only be an introductory price. It may not include the medical consultation, laboratory work, membership fees, shipping, or higher doses. Before signing up, find out what the medication will actually cost at the dose that you eventually may need. In my case, my doctor was able to get Zepbound approved by my health insurance company. However, based on how my plan is set up, it would have cost me $500 a month, where the compound one he's been using for some time now and trust is under $200 per month. And that's mainly based on how my prescription works with my copay on my own health insurance. So that was a no-brainer. $500 versus $200 and doctor recommended product. So I decided to go that route. So how is Terzepatide taken? The usual starting dose is 2.5 milligrams once per week for 4 weeks. The dose can then increase in 2.5 milligram steps, generally no faster than once every 4 weeks, depending on the treatment goal, effectiveness, and side effects. The maximum adult dose is 15 milligrams weekly. The first dose isn't intended to be the full working dose. It's mainly there to introduce the medication slowly and give your digestive system time to adjust to it. Brand name products such as Mounjaro and Zepbound can now come in several forms, including a single dose pen, single dose vials, multi-dose vials, and a 4-dose, they call a quick pen or quickie pen. A single dose pen is used once and discarded. The quickie pen contains 4 weekly doses, but each dose is the same prescribed strength. So you don't automatically dial up to a stronger dose every week. Your strength only changes when your doctor writes a prescription for the next dosage level. Compounded Terzepatide comes in a vial and the recommended dosage strength, but it's obviously not pre-measured for each dose. In my case, for example, at 5.0 milligrams, the bottle or vial would contain 20.0 milligrams or 4 doses at that 5 milligram level. That's how my particular prescription is prepared. Compounding pharmacies may use different concentrations, so never copy the number or of syringe units used by someone else. You need to follow the instructions for your exact vial. This also means there is no dispensing pen, and you will need to self-inject yourself. I had never done that before, but after the first time, the rest have been very easy. So, something else to consider when going the compounded route. Side effects. The most common side effects are mostly digestion related, nausea, diarrhea, constipation, vomiting, stomach pain, indigestion, possibility of fatigue, injection site reactions, and hair loss in some patients. In Zepbound's weight management trials, nausea occurred in approximately 25 to 29% of patients, diarrhea in 19 to 23%, vomiting in 8 to 13%, and constipation in 11 to 17%, depending on the dose. Most nausea, vomiting, diarrhea, that all occurs during increases and generally decreases over time. So the side effects you hear about most are the nausea, constipation, and diarrhea. And that makes sense when you remember that the medication is deliberately changing how quickly our digestive system works. But what has it actually been like for a regular guy, 62 years old, like me? Well, I can say with 100% certainty, I am eating much less than before I started Terzepatide. My hunger levels are way down. In fact, there are days I kind of have to force myself to eat. I have had a little bit of nausea, but not enough to make me think I would vomit. I mentioned hunger noise and that Terzepatide turns down the volume. Well, the volume of that noise is way reduced for me. I went from attending a rock concert to enjoying soft, easy listening music on low. So my hunger levels are way down. Other than that, I've not witnessed any other side effects to the point or to that point. And from what I gather from my doctor, that what I'm experiencing is typical, and what other patients that he has on the product are experiencing. The more serious warnings are thyroid warnings. So if you have thyroid issues, be sure to discuss that with your doctor. I'm going to put a list up of some other problems or possibilities, that things to be aware of, and everybody's different. So everybody's going to react to it different. And one thing is not for everybody. There could be 1,000 people that have absolutely no symptoms to the one person that has all of them, I guess. But the list is there. If you have concerns about it, again, just talk to your doctor. Anyone taking Terzepatide should tell their surgeon, anesthesiologist, or medical team before any kind of a major procedure. Even if you follow the normal fasting instructions, the medication may cause food to remain in your stomach longer than what the fasting allows for. Before you start using Terzepatide, especially a compounded version, you should be asking some questions. What licensed pharmacy actually compounded it? What is the concentration in milligrams per milliliter? How many milligrams and not merely units are in each dose? Are any other ingredients added? What are the storage instructions and expiration date? Who should they contact if the label, syringe markings, or the dosing instructions are unclear? Storage instructions can vary with the compounded medication. Mine came with specific instructions from the pharmacy, but viewers should follow the label on their own vial and contact the pharmacy if anything is unclear. Do not assume your medication should be refrigerated, frozen, or kept at room temperature based on what someone else has told you. People should also know that this can be a long-term treatment. Terzepatide manages appetite and metabolism when it's not being used. It does not permanently erase the biological tendency towards weight gain. In one withdrawal study, everyone initially received Zepbound and lost on average of 21% of their body weight. Those switched to placebo later regained an average of 14% from the point of withdrawal, while the other ones that stayed on Zepbound lost an additional 5%. Now, that doesn't mean every person will immediately regain all the weight. It means this probably shouldn't be viewed as a quick temporary diet and then just go right back to your same old habits. My honest opinion, you need to make changes in the way you eat, maybe forever. I don't know what your eating habits are. I only know what mine were and what I've changed up to this point for myself. I don't see myself ever going back to the old way of eating. And as I've said in previous videos, I still eat pretty much whatever I want. However, I know candy bars are out, other than maybe as a rare treat. I know running through the drive-thru is out. Again, other than a treat or maybe a reward. And honestly, I don't miss any of those things. I've substituted with more fruit, which helps with any sweet cravings. And I started meal prepping, which is huge. Most of the trips for fast food or a pizza were because I was hungry and simply didn't feel like cooking. So having ready meals in the house is a game changer. And I don't mean packaging every day something different. Make a casserole that can last you 2 to 3 days. Make a stew that may last you 2 or 3 days. Right there, you've got almost a full week's worth of food in 2 meals you prepped. And I usually do that on a weekend. Sunday evening, I'll cook whatever we're going to have that night. And then I'll also make whatever I need to prep for the week. So I know Monday, I've got a full week's worth of food already in the fridge, ready to eat. Put it on a plate, warm it up. And I also started a workout routine. It's said Terzepatide produces greater fat mass loss than lean mass loss, but some lean mass can still be lost. So it could be significant. This gives you a great opportunity to eat more adequate protein and increase movement, resistance training, go to the gym if you can. Make that all part of the journey. Again, I'm not a doctor, a chemist, anything in the medical field. I'm simply an overweight 62-year-old guy that likes to research things before jumping in, maybe sometimes too much, but always discuss these things with your doctor. I learned how important in these last 2 months that is by finding out the problem with the keto and my AFib issues. So that was the clinical explanation. I hope you found some useful information in this video. As always, if you have any questions, please let me know. I'm happy to share my experience. And to wrap this up, Terzepatide isn't magic and it isn't harmless. It's a powerful medication that changes your appetite, digestion, and blood sugar control. For the right person under proper medical supervision, it can be an incredibly useful tool. But understanding what you're taking, especially when it comes to compounded medication, is every bit as important as watching the numbers on the scale. If you learned something valuable or if you're planning to try Terzepatide, let me know down in the comments. As always, I would greatly appreciate it if you liked and subscribed. And remember, start today, move more, eat better, one day at a time, and I will see you in the next one. Thanks for watching.